A new study from the National Cancer Institute offers the most comprehensive look yet at the state of early-onset cancers in the United States, focusing on diagnoses in individuals under the age of 50. Although it confirms that certain cancers are rising among younger adults, the broader implications are not solely negative. This research sheds light on trends that are already influencing the medical community's approach to prevention, detection, and treatment, while also pointing toward promising avenues for early intervention and greater health awareness. One of the key takeaways from the study is that while cancer before 50 remains relatively rare, we are detecting more cases, especially of breast, colorectal, kidney, and uterine cancers. That increase may partly reflect progress in medical science, especially in screening and diagnostic technologies. Cancers that might once have gone unnoticed until later stages are now being found earlier, giving patients more treatment options and better chances of survival. The trend could, in part, be a reflection of a healthcare system that's getting better at identifying disease when it's most treatable. Breast cancer in particular saw the largest rise in absolute numbers, but it's also an area where treatments have significantly advanced over the past 2 decades. More nuanced understanding of tumor subtypes in precision medicine is allowing doctors to tailor therapies that are more effective and less toxic. The fact that more young women are being diagnosed may reflect heightened awareness and self-monitoring, combined with broader access to screening. Though any cancer diagnosis is difficult, catching it earlier often leads to better outcomes and less invasive treatment pathways. Colorectal cancer also showed a notable increase, and this has already prompted proactive shifts in screening guidelines. In recent years, organizations such as the American Cancer Society have lowered the recommended age for initial screenings from 50 to 45. This change, based on data such as those in this study, reflects a swift response from the medical community and a commitment to adapting public health strategies to emerging evidence. By identifying young adults who may benefit from earlier screening, particularly those with family histories or specific risk factors, we're expanding the safety net and potentially saving lives through timely diagnosis. Though the data show an upward trend for certain cancers, they also confirm declines in others. Lung cancer and prostate cancer rates in people under 50 have dropped substantially, likely tied to reduced smoking rates and more nuanced screening recommendations. These successes are a reminder that public health efforts can work. When we act with data, coordination, and determination, we can shift entire disease landscapes. The decline in smoking-related cancers is especially encouraging, demonstrating that decades-long campaigns on tobacco control are bearing long-term fruit, even in younger populations. There is also reassurance in the studies finding that death rates for most cancers among younger adults have not increased. In fact, survival rates have improved in many areas, thanks to breakthroughs in immunotherapy, targeted treatments, and multidisciplinary care. Young patients diagnosed with cancer today are entering a treatment environment that is far more sophisticated and hopeful than it was even a decade ago. The research underscores that while more people are being diagnosed, they are not necessarily dying in greater numbers, suggesting that we are managing the disease more effectively. Another optimistic element of the findings is the opportunity they offer for preemptive research and intervention. The fact that about 63% of these cancers are occurring in women provides a clear demographic target for future research and education efforts. It also allows for more focused funding, study design, and outreach to populations most at risk. The earlier we recognize a shift in cancer patterns, the better equipped we are to intervene, prevent, and educate, long before the problem grows beyond our ability to control it. As for causes, several possible explanations are being actively studied, including lifestyle factors, reproductive choices, and the role of obesity. Rather than being discouraged by the uncertainties, researchers are using these findings as a launching pad for major new inquiries. The scientific community is already planning large-scale collaborative meetings to dig deeper into the biological, environmental, and behavioral roots of this shift in cancer trends. The kind of coordinated attention from experts across disciplines offers hope that we will not only understand this phenomenon more fully, but also develop solutions that prevent future cases. Importantly, the study reaffirms the need for ongoing public health investment, not just in treatment, but in prevention, nutrition, exercise promotion, mental health, and early education. If rising rates of certain cancers are tied to modifiable factors like diet and physical activity, then the future is not predetermined. Rather, it presents a call to action. With informed choices, empowered patients, and a responsive healthcare system, we can continue to push back against cancer and even begin to bend the trend lines in the other direction. In many ways, this new study is a mirror that reflects where we stand today with cancer and a roadmap pointing to where we can go. The increases in certain cancer types among younger adults are not just warnings. They're signals guiding us to better awareness, stronger preventive care, and smarter research priorities. The challenges are real, but so are the tools we now have to confront them. We're seeing these cancers earlier, treating them more effectively, and building a deeper understanding of what drives them. In a long view, these trends may not mark a crisis, but a transformation, one that empowers a more proactive, personalized, and hopeful future for cancer care.